For anyone experiencing infertility, not being able to have children the way you wanted to can leave you feeling uncertain, isolated, among many other emotions. Just so you know, you are not alone. The World Health Organization says 1 in 6 people worldwide will experience infertility. So this will mean billions of people will share those feelings of distress and stigma around what it means to plan a family. Here to talk more with us about infertility is Dr. Prati Sharma from Create Fertility Center. Good morning and welcome to the show.
Good morning. Kelsey, thank you so much for having me on the show, and you hit the nail on the head. This is an incredibly prevalent issue. More and more people are experiencing infertility, and we're here to help them, support them in any way we can.
So let's talk a little bit more about that number. I mean, it's staggering, 1 in 6. Yeah. Do we know why the numbers are so high?
Yeah, when we look at that number of 1 in 6, we have to really go back to the causes of infertility, and those causes are varied. I really like to divide the causes of infertility into male factor, female factor, and other. When we talk about male factor infertility, we're looking at abnormalities in sperm production, sperm quality, count, motility, shape of the sperm. Female factor can have many arms. Typically, it's advanced reproductive age, so women who are over 35 and particularly over 37 and 40 have what we call diminished ovarian reserve. Their egg quality and egg number declines with time, but truly diminished ovarian reserve can affect women of all ages. There's also other causes, including anatomic factors, blocked tubes, uterine abnormalities, pelvic scarring, endometriosis, and hormonal issues, inability or lower abilities to ovulate normally, endocrine factors like hypothyroidism, high prolactin, and sometimes infertility is unexplained. 25% of infertility is no cause identified, and we just treat based on the technologies we have to assist in conceiving.
So hearing all that information, it sounds like one massive puzzle that you have to figure out.
It truly is.
For people who are looking to have kids, at what point do you have to go, or should you be seeking treatment?
Good question. So typically our rule is primary infertility is defined as failure to achieve a pregnancy with 1 year of trying. But we really say 1 year should be localized to women under 35 or younger women. If you're over 35 or particularly over 37, 6 months is enough. And if there's any gynecologic issue, irregular periods, pelvic pain, family history of infertility or early menopause, do not hesitate in seeking treatment earlier, because the earlier the better. We can identify issues sooner and help you sooner. The other path is alternative. So these days, we have lots of people from the LGBTQ community who are seeking building a family, whether you're a single female, a single male, a same-sex female, or a same-sex male. We have all these incredible technologies, egg donation, sperm donation, surrogacy, that can assist in building your family.
Yeah, so those are some of the options available for families. I know that across the country, there are different programs provincially.
Yes.
But when we look at options for people, affordable options for people,
correct,
what's out there?
Well, access to care is a huge issue now, and I think it's really been identified globally and in Canada. And so there are a lot of opportunities for people to access financial funding and help. And so I'm part of an organization called Fertility Friends Foundation. It's a registered charity in Ontario. We provide grants and financial assistance to patients who are undergoing IVF, egg donation, surrogacy, and sperm donation. There are also incredible fertility benefit providers coming into the market. Carrot Fertility, which I'm also a part of, is coming into Canada. They have insured over 2 million lives, and over 800 employers are purchasing these benefits to allow their employees to have access to fertility care, which I think is absolutely fantastic, because we're able to assist our patients who could otherwise not be able to achieve a pregnancy.
Doctor, you've been doing this for 15 years.
Yes, I have.
You've seen a lot of change over the time you've been doing this. If you could speak to our viewers right now who are listening, who are thinking, this is me,
yes,
what would you say?
You know, have an open relationship with your primary care provider. If you think you need assistance, do not hesitate to get a consult. I think fertility doctors are more than willing to see patients early. There's really a lack of a stigma around infertility anymore. We're having this open conversation. Patients are coming in to freeze their eggs, even if they don't have an infertility problem, to preserve their fertility for later. So just, if you think you might need it, or if you just want a fertility check to see where you're at, come in, see us. We can do some simple testing to see where you're at.
There sounds like so much hope in that.
Really, there truly is, and I couldn't be happier to be practicing in this time.
Doctor, thank you so much for coming on the show today.
Thank you for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.